It was pretty much every day. We worked 24/7 when I first got there, because in 68 and 69, the war was very, very intense. And we had casualties any time of the day, almost every day, whether it was a civilian or whether it was, the military. We had people coming in, and you worked 12-hour shifts. But if you heard the Hueys coming in, you dropped what you were doing and everybody went to their stations, because oftentimes it was mass casualties and you needed everybody. I had graduated at 18, gone to nurses training for 3 years. So at 21, I was on my way to Vietnam. The war had been going on for a long time, and being from a small town, you knew a lot of the young men who had gone, and some didn't make it back, and some came back wounded. And my family had been a part of the military probably since the Revolutionary War in one aspect or another. And I think that patriotism or sense of duty kind of, went through the generations. So it wasn't a hard decision for me. And what really capped it was the fact that I didn't have much money. I was going to nurses training, so my senior year, they would pay for my senior year, and then I would owe them 2 years in the military. It was actually an Army hospital. It was situated at Chu Lai. At Chu Lai, there were the Seabees and some air. There was an airstrip, so there were airmen there, and then there was the Army hospital. And they did that strategically because you weren't supposed to attack or bomb the hospitals. So a lot of times they would put them by airstrips or places of importance and, hope that they didn't get shelled or something. There was everything from chest wounds to head wounds, legs, arms, you name it, any part of the body. They would come in, usually in gurneys, some of them ambulatory. They would be put on what we would call sawhorse looking devices that were set up in stations. There were usually 4 of us, one in charge, and then 3 other nurses that would take charge of one station. The soldier was placed on the litter on those devices, and you would assess the patient. Almost everybody that came in got an IV, and that was intravenous, and if you couldn't find a place where you normally would start an IV, you would start it where you could. So it wasn't real uncommon to start IVs in the neck because of extremity wounds and that sort of thing. The ones that came in from the field, you always had to have someone there taking information from the soldier or from his medical tags, mostly from information that would have been sent with him on a piece of paper from the medic. And that particular piece of paper would tell you if he had had medication. A lot of times, they would get morphine, and so you wouldn't want to give them any more. So they would have an M written on their forehead so that you knew they had morphine in case the paper got detached from them. Basically, it was an assessment at first. You kind of saw what you were dealing with, took care of the ABCs, the airway, the circulation, the breathing, that they always teach you. And then you get to doing what you need to stabilize these soldiers, because we didn't really keep them except as a holding place, like preoperatively. There were many surgeons there. By many, I think we had 6 to 8 surgeons, and they would go into the operating room, and the soldiers would take their turn going in there, depending on the severity of their injuries. Usually you could tell because some of them with the multiple wounds, you don't really know exactly if they came through, because if they were really wounded badly and they made it through surgery and they made it through the surgical ward, then they were evacuated to the evacuation hospital. And then they were taken either to Japan or the United States. You really didn't know the outcome. And even though you saw their name on their paperwork when you were taking care of them and you called them by name, I don't remember the names. You just don't remember the names. I remember probably more the type of injury. There were a lot of chest wounds, a lot of extremity wounds, but a lot of these soldiers that came in were the age of my brother. And it's really kind of hard sometimes when you bring back the memories, I'm becoming more open. I have a granddaughter that's a senior, and she is very interested in things that that I did, and actually considering being a nurse herself. I think that it's part of that family thing. However, it was probably 20 years before I ever told anybody I'd been in Vietnam after we were married here. And that came out when one of the teachers found out that I had been in Vietnam, and he was a history teacher, and asked me to come to his junior class to speak a little bit about it. So I did. Well, my daughter happened to be in that class. And she came home and she says, "How come you never told us?" I didn't want to think about it. You know, and you were busy. You were really busy with the kids. You know, I had 4. So, you know, there was little other time. In fact, I didn't really get involved with the VFW until after the kids were graduated. And then, you know, you seem to have a little more time for yourself. And then I think your mind goes back to it a little bit. You know, you're not distracted by other things. And so you start kind of thinking. And sometimes that was good and sometimes that wasn't. I have a lot of respect for soldiers. I don't care what they've done. It takes 10 soldiers to back one combat soldier, whether it's in communications, whether it's in medical, whatever it is. It's a 10-to-1 ratio. And no matter what they did, they were important. And each one of them, I just have respect for all of them. But I especially have a heart for the ones who were there, because I know what they went through. I just feel like everybody needs to experience it. It's just a way of growing up. It's a way of broadening your horizons, more or less. And I know there's a lot of different ways you can do that now with all the different media things, but not all media is correct, as we all know. And I think if you experience something, you have experienced it. I know I've heard people question whether we should have the draft or not. I think I would lean that way, just simply because there's a lot of people out there enjoying the freedoms and the things that America has to offer, but are they willing to fight for it? Are they willing to really understand where that all came to them from, how it was paid for by somebody else? Yes, I'm glad that I went. I would do it again. I think I was naive when it first happened. But after having been there and seeing what was needed and what you could contribute, yes, I would do it again.